bone spurs. So today I'm going to be going over a topic that we get questions about a lot, and that is what we call bone spurs, what they are, how you get them, how you can treat them at home, and what we do in the clinic to help with them. So first off, a bone spur is also called an osteophyte. So what it is, it's calcium that gets laid down, typically not only in the joints, but around the joints and even on tendons and ligaments. Now, in our joints, let's say our knee, we have cushion and padding so that those bones don't rub together and cause pain and irritation. So in the knee, we have two things called meniscus. They're little discs. They're almost ear-like structures. Causes padding, cushioning, and also helps give space between the two bones of the knee. What happens is with wear and tear, altered mechanics of the knee, and breakdown of the meniscus is that those bones start to approximate. It squishes on that cartilage and ultimately can cause pain and irritation. Now, what happens if it's left for too long and does not get treated properly is that your body lays down calcium and creates those bone spurs and what we call osteophytes. It's your body's way of trying to heal itself. Now, the problem is once that calcium is laid down, it's laid down haphazardly, so they can be sharp and very irritating and actually make the joint way worse. So it's common not only in the rotator cuff, it's common in the knee, but also on the heels and is associated with what we call plantar fasciitis. So a couple things that you can do at home. You can do some heat, some stretches, and some exercises to possibly help with symptoms. Another thing I recommend is doing a castor oil wrap. So castor oil penetrates very deep within the system. So let's say it's in your knee. You can put that castor oil on there, wrap it, put some heat on there, 30 minutes a day, once a day, for as many times as needed. And sometimes that can help not only with symptoms, but breaking down that bone spur. One of the things that I definitely recommend that we do in the office is what is called soft wave therapy. So soft wave therapy is going to send in piezoelectrical waves into the tissue. It's going to break down deep scar tissue and adhesions. It's going to help with angiogenesis, so it's going to help with blood flow and nutrition delivery, as well as it's going to stimulate dormant stem cells to help your body recover optimally. So again, bone spurs, what they are, it's calcium that gets laid down. They're also called osteophytes. It is a wear and tear injury or too much stress on the joints. There's some things you can do at home, but in our office, we can definitely not only take x-rays and see exactly what is going on, but we can do those treatments and then do post x-rays to see if there is a change within those bone spurs and if we are breaking down that calcium properly so we can continue on the right path to healing.